You're listening to the Mother-to-Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Dahlman.
Welcome to another episode of the Mother-to-Baby podcast. My name is Chris Dahlman, and I'm a mom of four. I'm a genetic counselor, and I'm a teratogen information specialist. So I'm someone who gives information to patients and providers about exposures during pregnancy, during breastfeeding, while people are trying to get pregnant, and in cases of adoption. And an exposure can be anything. So it could be a chemical that you work with. It could be hair dye. It could be a medication. And today's focus actually is the second part of our two-part with Dr. Jessica Vernon, and we're going to be talking about medications that can be used to help treat perinatal mood and anxiety disorders. Dr. Vernon is an assistant professor at NYU Grossman School of Medicine. She's also a board-certified OBGYN, obstetric director of perinatal mental health at NYU Langone, physician advisor for Black Motherhood Matters Committee at NYU. She's a mom. She's a writer. She's been on the Today Show. She has a blog on Substack. She has her own website. I could go on, but instead I'm going to let her speak for herself. Dr. Vernon, welcome back to the show.
Hi, thank you so much for having me, Chris.
Happy to have you back. So let's dive right in. Dr. Vernon, could you give our listeners a brief summary about your experience that we talked about on the last episode?
Sure. So I am an OBGYN who's been practicing for over a decade now, and I suffered from undiagnosed postpartum depression and postpartum anxiety for close to 2 years before my symptoms got so bad that I started looking for help and realized what was going on. And that's why I'm here with you today, because I'm so passionate about helping to educate other moms about these conditions.
And we appreciate that. And what I'm so excited to have you talk about for our listeners are ways that perinatal depression and anxiety can be treated. So we do know that there are some wellness things that people can do. There's things like talk therapy, mindfulness, which could include things like yoga and meditation. But of course, there's also some medications that can be used as well.
Yes, absolutely. And I think it is important to know that every person is going to have a different idea of what will work best for them. And you might start with one type of treatment and then move to another. There's no right or wrong answer. For me, I had to start the medication before I would have been able to be relaxed enough and have the perspective to devote time to self-care for things like therapy, mindfulness, such as meditation and yoga. But for other moms, they don't need the medications right away, or they don't ever need them. And so everybody's path is going to be a little different. As long as you're reaching out for help and getting the support that's right for you, that's the most important.
And I think that's so critical to mention, because I know that some people think that it's going to be one or the other. It's like, well, I don't want to take anything, or I've already tried yoga and it's not going to work again. But you're right. Everybody is so different that there can be so many different approaches to get people to exactly where they need to be.
Right. And I think it's important that they realize that if you are struggling and what you're doing isn't working, that you need to ask for something else to add into your care. Because if you're struggling and you're not getting better, things can get worse, or they can persist like it did with me for years.
Absolutely. Do you find in your personal and professional experience that sometimes people have a hard time coming to the realization or accepting that they may need to use a medication while pregnant or breastfeeding?
Yes, I think for a lot of people, just accepting the fact that they are experiencing a mental health disorder such as anxiety or depression is very hard, because there is so much stigma and shame. There are a lot of cultural taboos. In some cultures, you don't even mention the word anxiety or depression. In some places, doing therapy is something that you would never consider. Mm-hmm. And so medication for a lot of people is is a tough acknowledgement that they are suffering and they need this help. But I would love for them to view it as a sign of strength that they're reaching out and getting the help, and not a sign of weakness, because so many people feel this shame, like, oh, I'm not strong enough to get through it alone. It's not anything that you're doing that's causing this, and it's not something that you can just tough it out and it will go away. It is a serious medical condition, just like diabetes or high blood pressure. And so sometimes medication is needed to make it better.
And sometimes I know I personally needed to be reminded that in order for my children to continue to be healthy as I was trying to feed them in different ways and basically just be with them, that my health too had to be a priority. I had to be well as their mom in order to take the best care of them.
Absolutely. And this is so important for pregnant and postpartum moms to understand, is that untreated anxiety or undertreated anxiety or depression has risks to the baby. When you're pregnant, there's risks of preterm birth, the baby having to go to the NICU, being small for age. Postpartum, you can have trouble bonding with your baby, which can lead to emotional and conduct problems and developmental delays. So it's really important to know that it's not selfish to take a medication. It's not selfish to participate in other self-care activities. It is very important because the mom is really the center of the family. And if you don't have a healthy mom, you can't have a healthy and thriving baby.
I agree. And there are some medication classes that are prescribed as what they call first line. So ones that, when possible, they would choose because we have information about them and we know a little bit more. In your practice and in your experience, what kind of medications would that be?
Yeah, so typically I would go first line to SSRI, or selective serotonin reuptake inhibitor. Now, if a mom has been on another medication before that is also deemed safe in pregnancy and breastfeeding, then we will often go back to that medication if it's tried and it has worked. Mm-hmm. But otherwise, something like sertraline, which is commonly known as Zoloft, or escitalopram, which is known as Lexapro, those are pretty good first-line medications to try with a mom. And also, besides your wonderful resource on MotherToBaby, these medications are deemed safe by reproductive psychiatrists. There's a great program called Massachusetts Child Psychiatry Access Program that created algorithms for providers to look at for treating these conditions in pregnant and postpartum moms. And these are their go-to medications as well.
And as you said, everyone is a little bit different. So you can start off on one, or if there was one that you've used in the past, they may want to try that again. And in some cases, they need to change or add or subtract. And in some cases, change the dosage. But I think the bigger thing that we wanted to let the audience know, or remind the audience who are familiar with us, is that there are treatments out there. And there is information about some of these medications. A lot of times we say there's, not enough. And I guess to us, there's never going to be enough, in quotes, information. But for things like the SSRIs, like for Zoloft, for example, there is information about the use in breastfeeding. And it's very helpful to have that to help appropriately reassure people that this is something that can be compatible with breastfeeding.
Absolutely. And a lot of people are also unaware that the old classification system that we used to denote if a medication was safe in pregnancy or breastfeeding or not, the Class A, Class B, Class C, that system is extremely outdated. We don't use that anymore because it's not really telling you how much data there is for each medication. It's just based on what data they have available. And so one drug might have one study that showed it seems to be okay, and another drug might have 10 studies that have shown differing information. So now we just look at the risks and benefits based on all of the current data as opposed to those classifications.
Absolutely correct. Thank you. Thank you for mentioning that, because that is something that we still, believe it or not, get questions on. So it was called the FDA pregnancy category system, which they also applied to breastfeeding. And you're right, A, B, C, D, and X, that was how it used to be done. But now what we're all looking at as resources and as providers is what the actual data looks like. And then, as you mentioned, that what we call at MotherToBaby a risk-benefit analysis is the risk of an untreated condition higher or lower than potentially treating a condition and having that person be as healthy as they can be. So what an excellent reminder that, we did do it that way before, but now we take a better look at the data in real time to try and do what's best for the patient. Dr. Vernon, I would like to share with our listeners that you are in fact pregnant again right now. Is that right?
Yes, it is.
Congratulations.
Thank you so much.
I would like to ask you to share, was there anything different for you going into this next pregnancy when thinking about your previous experience with postpartum anxiety?
Oh, there is so much I have done differently. From the very beginning, first of all, this was a little longer journey. I did do IVF this time, so I had plenty of time to prepare. And as IVF is also a risk factor for postpartum depression, and with my history of it, I knew I was a setup. And so besides just treating, another thing that we're also looking for in clinical practice, and I'm trying to do in my situation, is helping to prevent it in moms who we know who are at higher risk. So in my case, after looking at the risks and benefits, I decided to stay on my antidepressant medication. I feel very good about that decision. I feel better than I have ever felt. I do not have any anxiety or worries, and I'm just able to live in the moment and enjoy this pregnancy, which can be really hard as an obstetrician because I do see bad pregnancy outcomes all the time. But I've been able to focus on everything good going on and kind of just enjoy the process this time. Besides staying on my medication, I have also been seeing a therapist. I have a reproductive psychiatrist now as well. And I have a great support system. My OB knew from the very beginning that I was on medication. I had a history of postpartum depression, and she was very supportive. Also, a lot of people don't know that you might end up needing more medication as you progress in the pregnancy because we get more blood volume and fluid volume. And so I'm okay if I have to increase my medication. I know that that's not increasing the risks to my baby. Additionally, I am continuing to do a lot of self-care. I've learned that is important, not just for me, but for my baby and my whole family in general. If I exercise, if I do meditation, for moms who say they only have 5 minutes, you can go on, there's a wonderful app called Expectful, which has meditations for pregnancy and postpartum, as well as other great resources. And they're as short as 5 minutes. So you can literally lock yourself in the bathroom and do a quick meditation. I also am part of a support group that I am moderating as well. It's through Hey Jane. It's on Facebook. It's called the Hey Jane Postpartum Support Group. And myself and another wonderful woman, Lisa Tremaine, who has a huge PMAD center, perinatal mood and anxiety disorder center in New Jersey. We're moderating it. So I get to talk to moms every day. And there's something about the validation of knowing you're not alone in this that can be really helpful. So it's helped me from both sides, as both a clinician and as a patient. And, you know, just really treating myself with more grace and talking to myself as I would my best friend. I wouldn't judge them harshly or tell them they're a bad person if they were suffering from any of this. And so I've really just tried to be a better person to myself as well this pregnancy, and know that I do have the support system now to reach out if things do worsen and I do start to struggle.
I'm really glad to hear that, you know, you have found these ways to try and help yourself through this time. And again, just as a reminder that, you know, there are resources out there, and that talking to yourself as you would your best friend. I've heard that 100 times, and I got to tell you, I've done it much less than 100 times. And it's such a good reminder. It's so true. It's your best friend would never speak to you the way that many of us, including me, speak to ourselves. And it's just a great reminder to be more gentle just for so many reasons.
Mm-hmm.
Dr. Vernon, is there a final thought you would like to leave our audience with?
Yeah, I think just the biggest thing when you're looking at these conditions is just know that they are so common. About a third of women in recent studies post-COVID have shown do suffer. We used to say 20%, but the pandemic has really made that even greater. And so you are never alone. You are not a bad mom or a person or a weak person if you do experience symptoms. If you don't get help, this can go on for a long time and it can worsen. And if you do get help, these conditions are treatable. So please always reach out for help, whether locally, online. I promise you will find other people who are there to support you in a non-judgmental way and help you get better.
Thank you. Thank you for that. And thank you for being on the show today.
Thank you so much.
Good luck with your current pregnancy. We wish you the very best.
Thank you so much. It was such a pleasure, Chris.
Thanks. And don't forget that you can catch Dr. Vernon on that previous episode of the Today Show with Hoda and Jenna. You can also check out her website, Metamorphosis to Mom. You can also connect with her on social media as well, so Instagram and LinkedIn. And that's going to do it for this episode of the Mother to Baby podcast. Thank you so much for being part of our listening audience. If you want to have a more active role, so if you have an idea for the show or if you want to be on the show, if you have a question, we would love to hear from you. So please feel free to email us at contactus@mothertobaby.org. Don't forget to subscribe so you never miss a new episode of our podcast. Or you can also catch up on some older episodes on iTunes, Spotify, or however you listen to your podcasts. And you can also contact Mother to Baby if you have a question for one of our teratogen information specialists. So you can give us a call at 866-626-6847. You can text us at 855-999-3525. You can visit our website at mothertobaby.org, where you can find our fact sheets, our baby blogs, our episodes for the Mother to Baby podcast, and you can also chat with an information specialist right on our website. So until next time, thank you for listening. Thank you for being part of our audience. And remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.